The number of daily COVID-19 cases in Canada has been going down for weeks now. That's good news, but even today's low is far higher than it was back in the spring and the summer when we were locked down with less than half the daily cases we see these days. Now, granted, we have greater hospital capacity to accommodate higher case rates. We also have a much better understanding of the virus than we did back then. But those variants making their way around the world now have injected new uncertainty. So even with declining daily cases, how might the variants change things for Canadians? Well, let's figure it out with infectious diseases specialist Dr. Lenora Saxinger, also epidemiologist Raywat Deonandan joining us. Dr. Saxinger, let's start with you because we keep hearing two things about the variants, right? One, that they're potentially more contagious, maybe more dangerous, but also two, that they don't really fundamentally change what the average Canadian should do to protect themselves. So what do those variants really change?
Well, I think that it is kind of funny that we're saying that, these are in fact more transmissible, and so let's do the same thing. I think I would amend that to say we should do the same thing better. We should do the same thing harder. The same measures can reduce spread, but it's more challenging to contain. And so the basics have to be done just pristinely. And people who have gotten a little more relaxed should be a little less relaxed now, honestly, to help contain this.
And Raywat, do you see things the same way?
Oh, absolutely. For me, there are two big takeaways. First is that the stakes got much higher in terms of lack of compliance to public health guidance. And second, this really accelerates the timeline for vaccination. So we have to use our mitigation tools to buy us more time to acquire more vaccine supply to harden our most vulnerable population against these new variants.
Right, because Dr. Saxinger, the fear is what exactly? That if restrictions are eased in some places, that the variants could get more out of control than what we're, I guess, familiar with?
Well, I mean, what we've seen in other places is that, with certain restrictions in place, if the variants take over, they actually will continue to change your epidemic curve in the wrong direction very quickly. And so you need much stronger and more stringent restrictions to control them. So you don't want to get behind that. You want to be in front of it.
Raywat, do the new travel restrictions in this country go the distance in helping control the spread of these variants?
They may not be the biggest bang for a buck, but they're something and they're important. So it matters how many cases we are importing. If it's a handful, those handful become dozens down the transmission chain, maybe even hundreds. It matters that we're importing people through only a handful of airports. That way we prevent importing and seeding cases in parts of the country where the variant doesn't yet exist. It's also important that we don't export our cases to other countries, perhaps poor countries without the healthcare infrastructure to deal with this epidemic of a new variant. So all of this is quite important.
Okay, and Dr. Saxinger, one thing that I've been sort of wondering in my head is what is the point at which we would reconsider some of the really basic stuff that we know about this pandemic? So like 6 feet for physical distancing, whether we should all be wearing 2 or, I don't know, more masks or medical grade masks. What's your sense of that?
Well, I think it should be on the table that we would, take new evidence and act accordingly. And at the moment, I would basically take a very precautionary stance that if you can limit your contacts more, stay a greater distance away, and use a higher quality of mask, that those are good things to do right now. I would hesitate to make those like a mandated part of what we do until we actually see evidence of why it is that these are more infectious. But at the moment, I think just trying to do those things very, very well is a very reasonable thing to do.
Right. So if I'm understanding you correctly, we don't understand enough about how those mutations and variants behave themselves to recommend specific changes, like shortening the distance we keep from other people.
Exactly. I mean, we don't know whether it's a different dose of the virus, whether it's a longer period that it's transmissible. So there's a number of different things that could be at play, and designing a way to prevent that specifically would really require that information. But in the meantime, those basics we know prevent transmission.
Raywat, is Canada doing a good enough job tracking and understanding the scale of the variant problem in this country?
We can always do more, but I think we're doing what we can. So a percentage of the positive PCR tests undergo deeper genomic investigation, and the PCR tests themselves, a hand-waving approach is sometimes used looking at the gene targets to get a sense of whether or not we're actually detecting the new variants. Future variants, though, may not be detectable in this manner, and so to me it underlines a need to continue to invest in surveillance resources going forward.
And Dr. Saxinger, maybe one last question, and I fear this is maybe a dumb question, but why is it important for us to know the extent to which the variants have taken hold in the community, in the sense that, like what's an example where having that information would fundamentally change the way we deal with the pandemic or change our approach to it?
Well, right now, a lot of places are seeing some success with our measures in reducing case rates, and places are starting to eye opening up further and reducing restrictions. If we knew, for example, that there were community-based transmission events related to the new variants, and we knew that in advance of it really taking off our epidemic curve, I think we would really responsibly have to rethink what we want to do for reopening until we have a really good idea of the landscape of what's happening with the variants.
Dr. Saxinger, Rewat Deonandan, thank you so much for your time.
Thanks.
Thank you.